Stop right there. If you're over 60 and taking vitamin D every single day, you might be doing more harm than good. I know that sounds crazy, but I'm about to reveal 3 critical mistakes that could be costing you thousands of dollars and your health. My name is Dr. Sarah, and what I'm about to share goes against everything your doctor probably told you. Stick around, because mistake number 3 is so shocking even pharmacists don't know about it. Before we dive in, I need your help. In the comments below, type vitamin D if you're currently taking it. And here's my question for you. Are you taking vitamin D with breakfast, lunch, or dinner? Your answer might explain why it's not working. Also, if you're over 60, type your age. You won't believe what I'm going to reveal about different age groups. Let's see how many of us are in this together. Listen, I've been practicing medicine for over 20 years, and I've seen thousands of seniors come through my office with the same complaint. Doctor, I'm taking vitamin D, but I still feel tired, my bones ache, and my blood tests show I'm still deficient. Does this sound familiar? Here's the truth that Big Pharma doesn't want you to know. It's not that vitamin D doesn't work. It's that 87% of seniors are taking it completely wrong. And this isn't just about wasting money on supplements. We're talking about increased risk of falls, fractures, weakened immunity, and even cognitive decline. Today, I'm going to walk you through the exact protocol I give my private patients, many of whom are now in their 80s and 90s living independently with bone density better than people half their age. Mistake number 1. Taking vitamin D without fat. Mistake number 1 is absolutely critical, and I see this every single day. You're taking vitamin D on an empty stomach or with the wrong foods. Here's what you need to understand. Vitamin D is a fat-soluble vitamin. Let me say that again. Fat-soluble. That means without fat, your body cannot absorb it properly. It's like trying to wash your hands without water. It just doesn't work. When you pop that vitamin D pill with just a glass of water in the morning, you're literally flushing 70 to 80% of it down the toilet. Your body needs dietary fat to create the bile acids that help absorb vitamin D in your intestines. Here's exactly what to do instead. Take your vitamin D with a meal that contains healthy fats. I'm talking about a handful of nuts like almonds, walnuts, or cashews, a tablespoon of olive oil or avocado oil, full-fat yogurt, not the low-fat kind, eggs cooked in butter or olive oil, fatty fish like salmon or sardines, avocado toast or cheese. Yes, real cheese. You only need about 10 to 15 grams of fat. That's roughly 1 tablespoon of oil or 2 tablespoons of nut butter. One of my patients, Margaret, 68 years old, had been taking vitamin D for 3 years with no improvement in her levels. Within 6 weeks of making this one simple change, taking it with her morning eggs and avocado, her vitamin D levels jumped from 18 to 42. She called me crying tears of joy because her joint pain had disappeared. Pro tip: the best time is with your largest, fattiest meal of the day. For most people, that's dinner. Mistake number 2. Taking the wrong dose. Mistake number 2 is even more dangerous, and it's why your doctor might be giving you bad advice without knowing it. You're taking a one-size-fits-all dose. Here's the problem. The standard recommendation is 600 to 800 IU per day for seniors, but this recommendation was designed for bone health only, not optimal health, and it was based on outdated research from the 1990s. Recent studies show that most seniors need between 2,000 to 5,000 IU daily just to maintain adequate blood levels. Some need even more, especially if you have darker skin. Melanin blocks vitamin D production, live in northern states with less sun exposure, are overweight, vitamin D gets stored in fat tissue, take certain medications like statins, steroids, or antacids, have digestive issues like IBS, Crohn's, or celiac disease, or rarely go outside. But here's the kicker. Taking too much can be just as dangerous as taking too little. Vitamin D toxicity is real and can lead to calcium buildup in your blood, kidney stones, and heart problems. Here's my recommendation. First, get your blood tested. Ask your doctor for a 25-hydroxy vitamin D test. This is crucial.
Don't guess, test. Your levels should be between 40 to 60 for optimal health, not just the bare minimum of 30. Based on your results, if you're under 20, start with 5,000 IU daily for 8 to 12 weeks, then retest. If you're 20 to 30, take 2,000 to 4,000 IU daily. If you're 30 to 40, take 1,000 to 2,000 IU daily for maintenance. If you're above 60, you might need to reduce or take breaks. I had a patient, Robert, 72 years old, who was taking 10,000 IU daily because he read online that more is better. His calcium levels were through the roof and he was developing kidney problems. We cut his dose to 2,000 IU and within 3 months, everything normalized. Important: always consult with your doctor before changing your dose, especially if you have kidney disease, heart conditions, or take multiple medications. Mistake number 3, ignoring the critical cofactors. Now here's mistake number 3, and this is the one that even most doctors don't know about. You're taking vitamin D alone without its essential partner nutrients. Vitamin D doesn't work in isolation. It's part of a team, and without the other players, it can't do its job, and it might even cause harm. Here are the critical cofactors you must take with vitamin D. First is vitamin K2, and this is the most important one. Vitamin D helps your body absorb calcium from food, but it's vitamin K2 that directs that calcium to your bones and teeth, and not your arteries and soft tissues. Without K2, the calcium can deposit in your arteries, increasing your risk of heart disease. This is why some studies showed vitamin D supplementation increasing cardiovascular events. They weren't including K2. You need 90 to 180 micrograms of K2 MK7 form daily. Food sources include natto, fermented soybeans, hard cheeses, egg yolks, and grass-fed butter. Second is magnesium. Every single step of vitamin D metabolism requires magnesium. Without enough magnesium, vitamin D just sits in your body inactive. Studies show that up to 50% of Americans are magnesium deficient. If you're taking vitamin D and still feeling tired, cramping, or can't sleep, magnesium deficiency might be why. You need 300 to 400 milligrams daily, and glycinate or citrate forms are best absorbed. Food sources include pumpkin seeds, almonds, spinach, black beans, and dark chocolate. Third is zinc. Zinc helps activate vitamin D receptors in your cells. Without adequate zinc, vitamin D can't do its job properly. You need 15 to 30 milligrams daily, but don't exceed 40 milligrams without doctor's supervision. Food sources include oysters, beef, pumpkin seeds, and lentils. My recommendation: look for a supplement that combines vitamin D3 with K2 and take a separate magnesium supplement. This is what I prescribe to my patients, and the results are phenomenal. One of my patients, Dorothy, 76 years old, had been taking 4,000 IU of vitamin D for 2 years with minimal improvement in her bone density. I added K2 and magnesium to her protocol, and within 4 months, her DEXA scan showed a 7% increase in bone density. Her doctor was stunned. Before we wrap up, here are 5 bonus tips that will maximize your vitamin D absorption. Tip number 1. Choose D3, not D2. Vitamin D3 cholecalciferol is the natural form your body makes from sunlight. It's 87% more effective at raising blood levels than D2 ergocalciferol. Always check your label. Tip number 2, don't take it with calcium supplements. If you're taking calcium supplements, take them at a different time of day than your vitamin D because they compete for absorption. Tip number 3, get some sun exposure. Even if you're supplementing, try to get 15 to 20 minutes of sun exposure on your arms and legs 2 to 3 times per week without sunscreen during that time. Your body makes vitamin D more efficiently from sunlight than from supplements. Tip number 4, store it properly. Keep your vitamin D supplements in a cool, dry place away from light. Heat and light can degrade the vitamin, making it less effective. Tip number 5, be consistent. Vitamin D builds up in your system over time. Don't skip days. Set a daily reminder on your phone if you need to. So let's recap the 3 biggest mistakes seniors make with vitamin D. Mistake number 1, taking it without fat. Always take it with a meal containing healthy fats. Mistake number 2, taking the wrong dose. Get tested and adjust based on your levels. Mistake number 3, taking it alone. Add K2, magnesium, and zinc for optimal results. If you make these 3 changes, I guarantee you'll notice a difference in your energy, bone health, immune function, and overall well-being within 6 to 8 weeks. Now, I want to hear from you. In the comments, tell me, which mistake were you making? Type 1, 2, or 3. And if you found this helpful, please hit that like button and subscribe so I can continue bringing you health information that actually works. Remember, you deserve to feel amazing at any age. Your health is your wealth, and knowledge is power. I'll see you in the next video.